My name is Maroni Minter. I'm the political director at Massachusetts Immigrant and Refugee Advocacy Coalition, or MIRA. And I am honored to be the MC for this highly anticipated 100 days of press conference. We are gathered here today, 100 days into the Trump administration, to highlight the significant and damaging effect its policies have already had on our communities in Massachusetts. In just 100 days, we have seen sweeping changes that threaten the well-being, dignity, and rights of so many of our neighbors. We have seen immigrants and refugees who contribute so much to our economy, our culture, and our communities subjected to cruel, chaotic, and unfair policies. We have seen attacks on healthcare access, putting lives at risk, especially low-income families and marginalized communities. We have seen seniors who have spent their lives building and sustaining our communities face increased barriers to care and support. We have seen reproductive rights and access to reproductive health care undermined, with shocking consequences for individuals and families across the state. And we have seen people with disability and their families forced to fight even harder for basic services and protections they deserve. Today you will hear from advocates, community members, community leaders, impacted individuals who are standing up loudly and clearly to say we will not accept these injustices. We will organize, we will advocate, and we will fight for the Commonwealth and a country where everyone can thrive. Thank you for being here. Now, it is my honor to introduce our first speaker. My boss, Elizabeth Sweet, Executive Director of MIRA. And Liz is here to talk about the impact of the current administration policies on immigration and immigrant communities in Massachusetts. Liz?
Thank you, Maroni. So, just last week, the MIRA team was out giving a Know Your Rights presentation in the community, as we have done for literally thousands of individuals these past few months. And what was particularly notable about this particular group attending a Know Your Rights presentation is that it included many children between the age of 6 and 12 years old. And the kids had a lot of questions. Oh. Sorry, wind. The kids had a lot of questions for us. What do I do if I come home from school and my mom and dad are gone? I'm going to repeat that. What do I do if I come home from school and my mom and dad are gone? For thousands of children across our Commonwealth, this question is now a real daily fear. And it no longer even matters if their parents have some type of lawful status. With all the changes in policy, arrests and detention, even of individuals with status or who previously had status, these widespread fears reflect a new reality that so many individuals are now vulnerable or fear that they may be vulnerable to arrest and deportation. This federal administration, in just 100 days, has attempted to dismantle our immigration system and slam the door on immigrants who want to come here and make this country their home. There are so many substitute changes that have been made or attempted to be made to our laws and policies that throw so many of our neighbors into legal uncertainty and fear right now. These policies are intended to cause hurt and fear, and they are intended to send a message that this country is no longer a place of welcome. But we, the people of this Commonwealth, don't have to accept this wholesale rewrite of our story. We are fighting these new policies with lawsuits, with rallies, with hotlines, by simply connecting with our immigrant neighbors, friends, and colleagues to ensure that they feel welcome and safe right now. We are fighting these policies by working with our local and state leaders who believe in a different vision. We know that Massachusetts is stronger because of the 1.2 million immigrants who are part of our communities. We know that Massachusetts is stronger because of the businesses immigrants open. We have 91,400 immigrant entrepreneurs here in Massachusetts, generating $1.6 billion in business income. We know that Massachusetts is stronger because of the immigrant workers who make up 29% of our STEM industry here in Massachusetts, who power so much of our innovation. We know that Massachusetts is stronger because of the many immigrants in our healthcare system, from physicians to huge percentages of our nurses, home health aides, and those folks who are taking care of our loved ones when they are sick. So what happens when a child in Fall River, Massachusetts comes home to find that his mother was arrested in a traffic stop that day and detained? What happens when a father is arrested in a worksite raid in a grocery store in Brockton and his 3 children come home that day? These stories are happening all around us right now, some publicized and some not. And while we are working at that local community level to support people who are already being affected by these arrests and deportations, the increase in these stories and the increased harm to our Commonwealth is snowballing. And whatever the impact at the larger level, the impact to every single individual or family or child who's being affected is devastating. Yesterday, our leaders in the Massachusetts Senate voiced their concerns with these policies. And we at MIRA acknowledge that we are lucky to live in Massachusetts, where our state leaders understand the significant contributions that immigrants make. Together, we will find a pathway forward to fight back and ensure that Massachusetts continues to protect our immigrant communities. Thank you.
Thank you, Liz. And now, here to speak about the impacts of this administration's healthcare policies in Massachusetts, let's hear from Amy Rosenthal, the Executive Director of Healthcare for All. Amy?
We are here today standing with our partners to highlight the harm this federal administration has caused to people in our communities right here in Massachusetts in just the first 100 days in office. Healthcare for All advocates for health justice in Massachusetts by promoting health equity and ensuring coverage and access for all. We listen to tens of thousands of people who call our helpline each year, and the community partners, many of whom are here with us today, who we engage with. What we hear is that every area that influences the health and well-being of people in our community is under attack. Medicaid is under attack. Right now, Congress is making plans to cut $880 billion from Medicaid, which is in line with this president's agenda. If passed, these cuts would jeopardize access to life-saving care for the 1 in 3 Massachusetts residents covered by Mass Health, including half of children in the state and nearly 500,000 seniors and people with disabilities. People like Michael, who works part-time as a personal care attendant. Having Mass Health allows him to keep his diabetes under control and allows his clients to live independently in the community. We will fight together to protect Medicaid. Medicare is under attack. Cuts to the Social Security Administration have created delays and barriers for seniors who are trying to enroll in Medicare for the first time. We are hearing from people on the helpline who need to enroll into Medicare and are struggling to get an appointment at the Social Security Administration. This is not just an inconvenience, it's a barrier to care and could put seniors at risk of having to pay a penalty because they need to enroll in a specific time frame. We will fight together to protect Medicare. The Affordable Care Act is under attack. New proposed rules from the Trump administration would make health insurance more expensive and harder to get. People who buy health insurance through the Health Connector would have less time to sign up for coverage and face more red tape to keep the coverage they have. We have worked hard in Massachusetts to make health insurance more affordable. The proposed changes would make health insurance premiums more expensive, risking people dropping coverage. We will fight together to protect the Affordable Care Act. Yes. And public health is under attack. New leadership in health and human services is trying to dismantle successful and proven public health advancements, including vaccines and fluoride in water. We will fight together to protect our public's health. Yeah. We are grateful that the Massachusetts congressional delegation stands strong on these issues, and we will do all we can to support them in this fight. We are also appreciative of our state leaders who are standing up to the challenges, many that are coming about through the administration's actions, and we are working together to strengthen our laws in Massachusetts to protect people from further harm. We show our power when we speak out, and that is why it's so important that we are all here together today. We cannot let these attacks on healthcare and our communities and our state happen in the dark. We need people across the Commonwealth to understand what the Trump administration is proposing and make sure that he hears from all of us from up here in Massachusetts when we say that we will not go back on healthcare. We will not go back on affordability, and we will not go back on equity.
Yeah. We will fight! We will fight! We will fight! We will fight!
That's right.
We will fight!
Thank you, thank you. Our next speaker is Rosa Bentley. She's the statewide president of Mass Senior Action Council. Rosa is here to talk with us about how this administration's policies are badly affecting seniors across Massachusetts. Rosa?
Good afternoon. My name is Rosa Bentley, and I am the statewide president of the Massachusetts Senior Action Council. Founded in 1981, we are a grassroots, member-led organization of seniors committed to social justice. We come together to strengthen our voices and collective power in fighting for inequity and justice in aging. Today, I am proud to stand here with you all, with all of you here, because our unity, it needs more than ever in the face of hatred.
Yeah.
I will turn 80 years old this July, and while I have seen tremendous changes throughout my life, I never imagined I would see the wave of destruction that has defined President Trump's first 100 days. President Trump is trying to tear this country apart without regards for the harm he is causing. But we are here to show that he can't tear us down, because we will stand together and fight back. Social Security has been lifting seniors, people with disabilities, and survivor children out of poverty for nearly 90 years in Massachusetts. Social Security support about one in five residents. It is the benefits we have. I'm sorry. The Social Security support about 1 in 5 residents. It is the benefits we have earned and represent a contract between generations. In his 100 days, President Trump has caused fear and confusion. His aggressive workforce cuts and operational changes at the Social Security Administration undermines access to earned benefits and demonstrate a complete disregard for the hard-working people of this nation. We must be vigilant to protect Social Security for our future generation. President Trump has been ruthless in his attack on our immigrant community, denying due process or even fundamental human rights. We will not look away. We will stand together to fight for the rights of ours. Let's call cuts to Medicaid for what it is. It is denying low-income seniors family life-saving health care. Just as cuts to SNAP are denying people food. We did not fight for these programs just so billionaires could steal the money from the people who earned it. The latest attack from the Trump administration is proposing to eliminate the Administration for Community Living. Gutting of this 2012 bipartisan department will reverse decades of progress in supporting individuals with long-term care needs in the community. Proposing budget cuts to these programs will underfund it and eliminate vital services that support seniors and individuals with disabilities, put them in significant risk. We must stop this backwards movement and ensure people have access to the resources they have to live safely and with dignity.
Yeah.
All of these cuts are for just one reason, and that is so that Donald Trump, his billionaire friends, can get richer while destroying our security and denying us access to our hard-earned benefits. Trump and his gang of thieves claim they won't cut these programs, but when you stop funding so the programs no longer work, that is a cut.
That's right.
President Trump has demonstrated his intention to rule with fear, believing it will force us to hide where we refuse to hide. Together we will fight to ensure that we do not go back. Together we will fight for health care. Together we will fight for human rights. Together we will not go back. We will not go back. We will not go back.
Let's protect our seniors.
Let's protect our seniors.
Thank you so much, Rosa, for your tireless advocacy and for standing up for seniors. Thank you. Can we get Rosa a big applause? Thank you. And now, I mentioned the attacks on the reproductive freedom and reproductive care. So to understand how this administration's policies are harming reproductive care in Massachusetts, let's hear from Claire Tehulini, Senior Executive Director of Policy and Program at Reproductive Equity Now. Claire?
Good afternoon, everyone. My name is Claire Tehulini, and I'm honored to be here on behalf of Reproductive Equity Now, a New England-based organization dedicated to ensuring that everyone has access to the full spectrum of reproductive health care. Before I begin, I want to thank all of the incredible organizations that we are standing here with, Healthcare for All, MIRA, the Disability Policy Consortium, and the Massachusetts Senior Action Council for their daily work to uplift and advocate for the people of Massachusetts. In a moment where the federal government is working aggressively to undermine our rights, it is organizations like ours that are fighting to protect them. Today we've heard, and will continue to hear, about the wide-ranging attacks that this administration has launched in just its first 100 days. Attacks on healthcare, immigration, Social Security, and more. I'm here to talk about the attacks we've seen on our bodily autonomy and reproductive rights. Let's be clear about what we've seen. Within days of taking office, President Trump reinstated the Mexico City policy known as the Global Gag Rule, which prohibits foreign organizations receiving U.S. global health assistance from providing, referring for, or even discussing abortion services. This has deadly consequences for communities across the world, stripping frontline health providers of the ability to offer life-saving reproductive health care and information. In early March, the administration dropped the Biden DOJ's lawsuit challenging Idaho's abortion ban under EMTALA, the long-standing federal law that requires hospitals to provide stabilizing emergency care, including abortion care, when necessary. We've seen approximately 20,000 employees cut from the Department of Health and Human Services, key programs supporting maternal and reproductive health care dismantled, and just 10 days ago, the CDC laid off staff responsible for tracking critical maternal health and reproductive data, and fertility data as well. And to just name one more, the Department of Health and Human Services froze critical Title X family planning funding for 13 Planned Parenthood affiliates across the country, punishing providers who refuse to abandon their diversity, equity, and inclusion practices, and stripping critical preventative care away from millions of Americans. These actions are egregious, they are harmful, and they are deliberate. These actions over the past 100 days are signals from the administration. When the administration reinstated the Global Gag Rule, they didn't just accept the United States' maternal health crisis, they actively sought to export it around the world. When they dropped the Idaho lawsuit, they were not just signaling indifference to patients denied life-saving emergency care. They made clear that they are unwilling to defend federal law when it conflicts with their agenda. When they eliminated critical agencies and staff, it wasn't cleaning house. It was a calculated effort to consolidate power and strip away checks and balances. When they froze Title X funding, it wasn't just about cutting health care, it was about rewarding political allies and punishing perceived enemies. Every attack we are witnessing is a part of a larger strategy, a strategy to dismantle our rights, to silence our voices, and to strip us of our bodily autonomy. But here in Massachusetts, we are clear-eyed, and we are ready. We are undeterred. Even in the face of egregious attacks, the people and advocates here continue to show up and fight for health, equity, and dignity. I'm proud to be here in a state where both our state and federal legislators stand with us, where our communities refuse to be silenced, and where we continue to lead by example. Trump's second administration has made clear just how critical strong state-based leadership is in this moment. And it is our community that will be the force standing firm against the federal assault on our rights. Thank you.
Reproductive equity, reproductive equity, reproductive equity. Thank you, Claire. And now I'd like to introduce Dennis Healy. He's a health justice advocate and the co-founder of Disability Advocates Advancing Our Healthcare Rights. Dennis is here to speak about how the administration's policies are affecting people with disabilities, their families, and community.
I've spent much of my life as a disability advocate working with other advocates to advance and promote civil rights of folks with disabilities, and really making strides that led to the passing of the ADA, Homestead, and just improvement in people's lives generally around the United States. Not just people with disabilities, but their families and folks who help us out, personal care attendants and other folks. And now we find ourselves being denied our civil rights and being denied actually our right to exist. Because without Medicaid, without insurance, it's really euthanizing people with disabilities and elders. It's saying you don't have a right to live. Because Medicaid is the only way we have access to health care. It's not only saying that to us, but it's also saying that to folks from other populations as well. I think of folks, children who are immigrants here with disabilities, adults with disabilities, who are treated cruelly by this administration and not getting access to the appropriate health care they need when they're detained. And so it's really about the broad human rights agenda that the Trump administration has, doing away with anything that has to do with people's right to really live as a decent human life. I could go into some of the things he's done, but I'm not going to do that. I will say that I have a personal care attendant right now who is petrified because he keeps getting letters that say that his visa status has changed. And then there are always things on the internet that talk about how the visa status has changed, and they're not true. So there's all this misinformation out there that this poor guy is receiving. He leaves the house and is petrified of ICE waiting outside the door. And they don't, and I'm petrified because if this poor guy gets deported, then who am I going to have to get me up in the morning? And so all of us are interconnected here, and I think that's one of the messages we really need to bring. Is if Medicaid is decreased, Medicaid goes away, if our rights go away, that's hundreds of thousands of jobs that are being taken away. 100,000 jobs. It's a complete decimation of our economy. The decimation of Massachusetts economy, which is the most progressive economy in the United States. So I think for me, it's not just about folks with disabilities. It is. It's not just about elders. It is. It's not just about folks, immigrants, and women's rights. It is. But it's really about all of us as a collective, recognizing that if we don't stand together, we all lose. And so we have to come together and fight against Trump and against all that he stands for, because we will all fall down and we will all be worse off. So please, don't think this is just the healthcare for all rights. It is healthcare for rights, all healthcare for all rights, but it's about all of our rights together, and we need to support each other. So thank you.
Inclusion for all. Inclusion for all. Inclusion for all. Thank you, Dennis. Thank you. And that really concludes our press conference. I just want to thank all of you for being here. I want to thank all of our speakers, all of the advocates here, the media here, and everyone for being here. It's a gorgeous day. You could choose to be somewhere else, doing something more fun. Not that this is not fun. We certainly appreciate you being here. This certainly shows that you are here standing in solidarity with all the communities that are impacted by this administration's policy. And so thank you all. With that said, I think this is time where perhaps we want to welcome some questions from media. And I know we have some folks who are available to take some questions. So that again wraps up this press conference. Thank you all so much for being here. Thank you.